Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is humerus. So this is the humerus bone. You can see that. So today we will discuss this bone. So first of all, humerus is a long bone. Okay, and each and every long bone has three parts. These are, one is upper end, one is body or shaft, and third one is lower end. Okay. So in case of humerus, this is the upper end, this is the body part, and this is the lower end. Okay. Now we'll discuss one by one. First of all, upper end. Upper end consists of hemispherical smooth head, so upper end, in the upper end, first of all, this is the upper end. Okay, and in case of upper end, this is the hemispherical head. You can see this part, and this hemispherical smooth head, it is directed upwards and medially, and which articulates with the glenoid cavity of the scapula and forming the shoulder joint. So this part attached with the glenoid cavity of the scapula and forms the shoulder joint. Okay, so it is directed upwards. This will be directed like this, not like this. This is directed upward, and it should be not laterally, it should be directed medially. Okay, like this, and which articulates with the glenoid cavity of the scapula and forming the shoulder joint. Now after the head, there are presence of neck. Number one, head. Number two, neck. Neck has three parts. One is anatomical neck, one is morphological neck, one is surgical neck. So in case of neck, there are three parts. Okay, one is anatomical, one is morphological, and one is surgical. So the anatomical circumference, this anatomical circumference of the head is called the anatomical neck. So this is the anatomical neck. I think you are seeing in the bone clearly. This is the anatomical neck. Okay. So the anatomical circumference of the head is called the anatomical neck. And now the morphological neck, if we can draw a circular line that cuts off the both greater and lesser tubercle, these are the greater and lesser tubercle. If we draw a circular line like this and that cut both the greater and lesser tubercle, then we found a circular line. This is known as morphological neck. So what is morphological neck? If we can draw a circular line that cuts off both greater and lesser tubercle, that line is called morphological neck. Now the surgical neck. Surgical, the term comes from surgery. So if we draw a circular line just 2 centimeter below from the lesser tubercle, that line is known as surgical. So this is the position below the lesser tubercle, 2 centimeter below. This is the surgical neck position. If we draw a circular line 2 centimeter below the lesser tubercle, that line is known as surgical neck. And in front of this neck passes the axillary nerve, okay, which is origin from posterior cord of the brachial plexus. And if the surgical neck is break down, then axillary nerve is injured and deltoid muscle cannot perform the abduction movement. Then the paralysis will happen. The patient cannot move. Abduction movement is completely stopped. So we have cleared the concept of neck. So we have discussed the head and neck. So head is the hemispherical smooth head. Neck has three parts: anatomical, morphological, and surgical. Now there is two tubercle present. Okay, two tubercle or tuberosity. One is greater tubercle and one is lesser tubercle. You can see that this is the big one, so this will be the greater tubercle and this one is the lesser tubercle. Now intertubercular sulcus. In between the two tubercle, the greater and the lesser tubercle, there is one sulcus, or in Bengali you can say khaj, that is present, that is known as intertubercular sulcus, which is further continued as bicipital groove. So we have completed the apparent. In case of apparent, what are the structure? First of all, head, then neck. In case of neck, there are three part: anatomical, morphological, and surgical. So this is head, this is anatomical neck, this is morphological neck, this is surgical neck, and there are two tubercle or tuberosity present: greater tubercle, lesser tubercle, then intertubercular sulcus, then bicipital groove. So what are those structure? One is head, neck, then two tubercle, then intertubercular sulcus, then bicipital groove. Now the lower end. Lower end has two parts. One is articular part and one is non-articular part. This one is the lower part. Okay, you can see that very clearly. This is the anterior part of the lower part and this is the posterior one. So lower end has two parts. One is articular and one is non-articular. So articular part means when the part is articulates with another bones. If we discuss, whenever we are discussing that articular part, the articular part is articulating with another bone, and non-articular part, this part is not directly attached to any bones, but during movement of elbow joint, attachment or articulation may occur. Okay. In case of articular part, there are two parts we can again gain, that is capitulum and trochlea. Capitulum laterally and trochlea medially. Okay. Capitulum articulates with the head of the radius. And it forms the humero-radial joint. And the trochlea part articulates with the trochlea notch of the ulna. Which will further form humero-ulnar joint. So if we see capitulum and the trochlea, this is as it is a left side bone, we will discuss how to side determination occur. Then it is a left sided bone. Okay, and then you can see that there is capitulum and trochlea. Radius is the lateral bone, so this is laterally present capitulum and it is trochlea, and trochlea is present medially and capitulum is present laterally. And in this position, head of the radius is articulates and forms the humero-radial joint. And in this position, the trochlear notch of the ulna articulates and form the humero-ulnar joint. So here is humero-radial joint and here is humero-ulnar joint. So okay, you have discussed. Now, in case of non-articular part, there are three fossa and two condyles. One is radial fossa, one is coronoid, one is olecranon, and two condyle. One is medial condyle or epicondyle. Both of the terms are correct, and known as lateral. So this is the humerus bone. This is the lateral side. This is the medial side. And in case of humerus, there are three. In case of articular part, we have discussed capitulum and trochlea. And in case of non-articular part, there are three fossa: 1, 2, and 3. In case of the lateral side, this is radial fossa. In the medial side, the coronoid fossa. And in the behind or posterior part, there is olecranon fossa. Okay. And two condyle. In the medial side, this is medial epicondyle or condyle, and this is lateral condyle. Okay. Lateral condyle, medial condyle. Radial fossa, coronoid fossa, olecranon fossa. Radial fossa, coronoid fossa, and olecranon fossa. Now we will discuss about the elbow joint. How the elbow joint is formed. Elbow joint is consist of three joint. Okay. One is humeroradial joint. And humero-ulnar joint. And the superior radial joint. These three joint combines and forms the elbow joint or cubital joint. This is radius, this is ulna, this is humerus. This one is humeroradial joint. This one is humero-ulnar joint, and this one is superior radio-ulnar joint. Here is humeroradial joint, here is humero-ulnar joint, and in this position the superior radial joint is present. And these three joint combines and forms the elbow joint or the cubital joint. And there is a depression present in the elbow joint part. This depression is known as cubital fossa. So we have cleared the upper end and the lower end. Now we are going to discuss the body or shaft part. Body or shaft. Okay. Upper part of it is rounder. As you can see, upper part is rounder or cylindrical, but lower part is wider. You can see upper part is rounder and the lower part is wider. And it has three border and three surfaces. So there are three borders and three surfaces. So what are the border? There is anterior border, there is lateral border, and there is medial border. Okay. As you can see in the bone, this is anterior border, this is lateral border, this is medial border. Okay. Anterior border, the upper part of this is prominent. As you can see, the upper part is much prominent. Okay. And the lower part is ill defined, and in the next part you can see this is not that much prominent. And the lateral border next. The lateral border, this is also known as lateral supracondylar line. It starts from the lateral condyle of the humerus. This is the lateral border. Here starts. So what is the lateral border? Lateral border, which is also known as lateral supracondylar line, it starts from the lateral condyle of the humerus. And medial border, it starts from the upper part of the medial condyle of the humerus. And this is also known as medial supracondylar line. Now surfaces. One is anterolateral surface or lateral surface. This is number one. One is anterolateral or lateral surface. Number two, anteromedial or medial surface. And number 3, the posterior surface. So lateral surface is present in between anterior and lateral. So this surface is known as which surface? Lateral surface. Anterior border and the medial border in between the position is known as the medial surface, and in between the lateral border and the medial border there is the posterior surface. So 3 border and 3 surface: anterior border, lateral border, medial border. Surfaces: lateral surface, medial surface and posterior surface. So we have completed the upper end, lower end and body or shaft part. Now we will make a schematic representation of this part. Upper end, lower end, body or shaft. So upper end is consist of head, which is hemispherical smooth head. Then neck. One is anatomical, morphological and surgical. Then greater tubercle. Then lesser tubercle. Then intertubercular sulcus. Then bicipital group. Then comes the lower end part, that is articular and non-articular. In case of articular, there is capitulum and trochlea. Capitulum for radius, trochlea for ulna. Capitulum forms the humero-radial joint, trochlea forms the humero-ulnar joint. And non-articular part has 3 fossa and 2 condyle: radial fossa, coronoid fossa, olecranon fossa, and medial condyle, lateral condyle. And body or shaft, there are 3 border and 3 surfaces: anterior border, lateral border, medial border, lateral surface, medial surface, posterior surface. Okay, so this is the schematic representation of the upper end and the lower end and body or shaft part. So if you have some question that which is the largest and strongest bone present in the upper extremity, that is humerus. And what are the common parts of the humerus? That is upper end, then lower end and body or shaft. Now the head of the humerus articulates with which bone? The head of the humerus articulates with the glenoid cavity of the scapula, and it forms the shoulder joint, which is a synovial joint, and its subtype is depends on the shape of the bone, articulating bone. And as it is look like ball and socket, this is look like ball, and the glenoid cavity looks like socket. So this joint is called ball and socket joint. And which long bone is placed horizontally? If you ask a question, you can say that is clavicle bone or collar bone or beauty bone. Now what are the neck? That is anatomical neck, morphological neck and surgical neck. The anatomical circumference of the head is known as anatomical neck. If you can draw a circular line that cuts off both greater and lesser tubercle, that is known as morphological neck. And 2 centimeter below of the lesser tubercle, if you draw a circular line, then we can found the surgical neck. And here is the presence of axillary nerve. And if the surgical neck is break down, then axillary nerve is also injured. And when that bone is injured, the deltoid muscle cannot perform the abduction movement, and this can happen in case of surgical neck injury. And greater tubercle is laterally positioned and the lesser tubercle is medially positioned. Here you can see that this is the greater tubercle and this is lesser tubercle. Greater tubercle is always laterally and lesser tubercle is always medially. Now we will discuss about the side dimension of the humerus. So side determination point, first is we will discuss by head. Head is directed medially. Then the lesser tubercle is directed forwarded. Then olecranon fossa is directed posterior part of lower end. Now side determination start. So you can see this is a humerus bone, this is the head. Head is directed medially. So this bone, this is, we know that lateral and medial position. So this is not like this, not like this, not like this. This should be like this. This is medial position, this is lateral position. So like this. Now the second position is lesser tubercle is directed forwarded. You can see that lesser tubercle, which is directed forwarded, as it is in medial position, it is always directed forwarded. And the olecranon fossa, you can see in the behind, this is directed posterior part of the lower end. So this is the position. So this is happening in the left hand. But if you hold in right hand, then the lateral, the head is directed is lateral side. So if the head is directed laterally, then the bone cannot be in right handed. Then the bone must be in left handed. If you hold this in the left hand, then the head is directed medially, the lesser tubercle is directed forwarded, and the olecranon fossa is directed posterior part of the lower end. So okay, side determination is completed. Now we will discuss about the attachment of the humerus. Attachment is divided into three parts. Okay. One is bony attachment, one is muscular attachment. So first of all, we will discuss about the bony attachment. So bony attachment means that what are the bones which articulates with the humerus and forms the different joints are called bony attachment. So what is the bony attachment? Bony attachment means what are those bones which are articulating with the humerus and forms different joints are called bony attachment. So first of all, in the head part, head of the humerus articulates with the glenoid cavity of the scapula, which is known as glenohumeral joint. Glenohumeral joint, and it is also known as shoulder joint, and the type is synovial joint, and the subtype is ball and socket joint. So bony attachment, first of all, the head part. In the head part, that is the in the first position, that is head is articulating with the glenoid cavity of the scapula, which is known as glenohumeral joint or commonly called shoulder joint. It is the type, it is typically it is synovial joint, and the subtype is ball and socket joint. And in the next part, the lower end of the humerus, as the body has no bony attachment, in the lower end, first is radiohumeral joint or humeroradial joint. Both are correct. So humeroradial joint, it is the capitulum of the humerus, and the head of the radius is forming the radiohumeral joint or humeroradial joint. Capitulum of humerus and the head of the radius forms the humeroradial joint, and it is the type is synovial, and subtype is hinge joint. Then the humero-ulnar joint. And in case of humero-ulnar joint, it is the trochlear notch of the ulna which articulates with the trochlea of the humerus, and it is typically synovial joint, and the subtype is hinge joint. Now we will come to the muscular attachment. Muscular attachment, first of all, we will start by greater and lesser tubercle. In case of greater and lesser tubercle, there is present of rotator cuff muscle, and rotator cuff muscle there is presence of teres minor, supraspinatus, triceps, and pectoralis major. And to the bicipital, next is to the bicipital group. In the bicipital group, there are two margins. One is lateral margin and one is medial margin, and there is present one floor. So this is lateral margin, this is medial margin, and this is floor. Okay. So we have a trick to remember the muscle names, that is lady between two measures. Okay. So lady means latissimus dorsi, which is present in the floor. And in the lateral margin there is pectoralis major, and in the medial margin there is teres major. Okay. Now we will discuss about the contents of the bicipital group. This is very important. This is the favorite question of the viva. So what are the contents of bicipital group? That is, first, tendon of biceps brachii. Okay. Then the ascending branch of anterior or humeral circumflex artery. Ascending branch of anterior humeral circumflex artery. So these are the contents. One is tendon of biceps brachii and the ascending branch of anterior humeral circumflex artery.